I'm Dr. Joe Albano. Let's talk about stem cells and arthritis. A lot of my patients come to me seeking non-surgical alternatives for arthritis treatment. There are actually quite a few of them. The more conservative ones start with medications. Non-steroidal anti-inflammatory medications are not my favorite. They have side effects which can include stomach ulcers, so I'd prefer not to start my patients on that. Another better alternative, which is also a pill, is using fish oil. I recommend at least 2.5 grams of omega-3 fatty acids per day and up to including 5 grams per day or even more. We could also use glucosamine and chondroitin. The data behind that are not as robust as with the fish oil, but if it works, that's great. It's not going to really cause any harmful effects. We could use bracing. If you have a certain type of arthritis, we can use an unloader brace for medial or lateral arthritis. When it comes to injections, there's several options for that. A standard option is to use steroids. This is really not a good one when we're trying to regenerate tissue because there's a lot of good data that shows these steroids damage the tissue. So that's not really what we want to try and do. So I don't recommend that. Another common one is to use hyaluronic acid or viscosupplements. There's a lot of brand names for these, including Supart, Synvisc, Euflexa, Hyalgan. These actually won't damage the tissue, and they're okay to do, and they may provide some relief the pain. They're usually provided in a series of injections spaced a week apart, up to 3 to 5 weeks apart. Insurances may or may not pay for these injections, but if they do, they'll cover them typically up to every 6 months. Now we get into the non-insurance covered options. First is platelet-rich plasma. We get that by drawing your blood, getting a concentration of the platelets. These have lots of growth factors in there. Then we get to stem cells. We can use your own body's fat, which has a lot of stem cells, believe it or not. We can use your own body's bone marrow, which has a different kind of stem cells. Lots of times we'll combine these, and those work very effectively. We have other options which will include amniotic fluid, placental tissue, or umbilical tissue. These are not from your body, obviously, but they're immune privileged and your body does not reject them. They can provide relief of pain. They don't usually work as well as your own body's stem cells. Typically, it'll take 1 to 3 of these injections and these treatments to get a full response. A lot of times we'll recommend irrigation or lavaging or washing out of a joint if that's involved before we do the stem cells. The reason for that is to get out all of these inflammatory proteins that are in the joint fluid. Wash those out, then we inject the stem cells in there. They have nothing to fight against and a better chance of healing. After about 4 weeks from the stem cell injection, there's increased laying down of tissue, and then at the 4-week time frame, body stops laying down tissue. And if we hit it with new growth factors at that time using your own body's blood, the PRP, then that can really help improve the healing response. Sometimes we'll have to put you in a brace or crutches. If it's a lower extremity injury, what we'll do often is have you non-weight bear for 2 weeks and then partial weight bear the 3rd week. The reason for that is not because you're not able to put weight on it. You can walk out of the office and do that, but I don't want you to, because it's just pounding and damaging the tissue and not giving it a chance to heal. So we found that that works better. People ask about the success of these treatments. It depends is the answer. It depends on what exact condition you have and how severe it is. In general, the more severe the problem, the less successful it's going to be. So it's really good to catch these earlier to have more of a chance of success with these type of regenerative procedures. If you do have a more severe condition, that doesn't necessarily mean that these procedures can't help you out. If, for instance, you want to run ultra marathons and you have severe knee arthritis, maybe this isn't the best answer for you. Most conditions, however, can benefit from these types of procedures. So let's talk and see if we can help you get back to doing what you love to do.